Welcome everybody to the Canadian Alliance COVID-19 webinar series, among other webinars that we've been doing. We're excited to have you all here. Right now it looks like we have just over 200 people on the call, with more coming in all the time. So again, welcome, and please make sure that you let us know in the chat if you're having any technical difficulties and so forth. But we're really excited today to have a great guest speaker with us who we'll keep secret for the moment, but we'll introduce her right away. Actually, I think she's very well known amongst the group that's on the call. Just to introduce myself and my co-host, I'm Wally Check. I'm the Director of Training with the Canadian Alliance to End Homelessness Training and Technical Assistance Program. And as you see in the video, Jody Yurkowski-Pace, who is one of my staff, coordinate access trainer. So we're happy to be here today and talk to all of you and support Tracy in this webinar. So Jody will be helping us keep track of all of your questions and those kinds of things so that we can be much more efficient in the end when and if there's time for that. It's important for us to just make sure you know who we are at the Canadian Alliance. We are multifaceted, and I would encourage you to go to the Canadian Alliance website at cah.ca, and you can check out the various aspects of what we do. Much like the National Alliance to End Homelessness in the United States, we have a national conference every year that has been getting around 1,500 participants each year now, although this year has officially been canceled. The next one will be in 2021. So we'll look forward to that. And then we have Built for Zero here in Canada, just as they have Built for Zero in the United States. And then our training and technical assistance, and then a group of partner organizations that make up our allied networks. And there's lots of great work happening there. And as I said, feel free to go to our website and check out that work that's happening. Our mission, very simple but important, leading a national movement of individuals and organizations and communities working together to end homelessness in Canada. And apparently now we're also working to end homelessness in the United States by the number of US people on our webinar today.
Yeah,
so we're happy to help you out. It's important for us to mention the Government of Canada, in particular funding through the capacity and innovation stream of Reaching Home in Canada. They have made it possible for us to be able to do these webinars and do much of the work that we do at the Canadian Alliance. So thank you to them. And again, our webinar will last an hour. It is being recorded, and the recording of the webinar and a PDF version of the slides will be available on our website probably before the end of the day today, at the very least tomorrow morning, so that you can review them, or if you know people who wanted to catch the webinar but couldn't, they'll be able to see all of that information later on. And again, we'll have time for Q&A and discussion at the end if there is time, and we'll go on from there. Again, please use the Q&A feature if you can for your questions. That makes it easier for us to monitor those. But we will be monitoring the chat as well. And if you type in a question, at the end of that question, if you would just indicate whether you're able and willing to speak, then we would rather unmute you and let you ask that question than to have us ask it for you. But if not, then that's okay. We'll read out that question, and our presenter will be able to address things. So our agenda is simple. I'm going to provide a brief introduction to our presenter, and then let her tell you anything additional about herself that she would like to. She'll provide the information she's prepared, and then we'll, again, time permitting, have some questions to talk about, and then we'll have a few closing comments. And that's about it. So at this point, I'm going to actually unshare my screen so that our presenter, Tracy Wilmot Flattery Wilmot, sorry, from OrgCode, is here today and is going to be providing us information on prevention and diversion, in particular during this pandemic time that we're facing. But Tracy has been working for OrgCode for several years now and providing training all over Canada and the United States, and providing other kinds of support and to people everywhere. Before that, she actually was a big factor in a lot of the success that occurred early on in Medicine Hat, Alberta. So I think Ian stole her from Medicine Hat, but they've gotten the benefit of her services since that time as well. But otherwise, Tracy, I'm going to turn it over to you and let you can share your screen and then take control of your own slides, and we'll go from there. But welcome and thanks for coming and providing this information.
Fabulous. So just to be really upfront with people, this is my first time using the Zoom as part of our opportunity to do this work. So I'm just going to make sure that you can actually see my screen. Can you do that, Larry? Wally, sorry?
No, not yet. Sometimes it takes a second to pop up there, but yeah, if you just click the green share screen button.
Yep.
And then you just click, if you're using dual monitors, you just have to make sure you click the right screen and then.
All right. Okay.
Don't worry, this is a common challenge.
Yeah.
Thanks, Cheryl. Cheryl told me I was still looking like I was Tim Richter, so I had to change my name.
All right. So, any luck?
Not yet, no.
That's not good.
That's all right. It'll come.
So one thing that I can do, Wally, is actually send you my PowerPoint just in case.
Yeah, sure. No problemo. While you're doing that, Tracy, is there anything else you want to share with folks about you, about OrgCode, the work you're doing?
You bet. You bet. So I've sent that off to you.
Okay.
So just to get started, I want to thank everybody for being a part of this session. And sorry for the technical issues. Those of you who can't see me on video, you'll thank me because I actually replaced, I'm upstairs in the top part of my house in Ottawa, and replaced what it used to be right here behind me, which was my wedding picture from about almost 25 years ago, and replaced it with a much nicer picture. Like everybody else, or a lot of people who are working remotely right now, trying to juggle everything. Really glad that everybody was able to attend. One thing that becomes extremely important for us, of course, is the recognition being that as we continue to deal with COVID-19, recognizing that we're likely in wave 1 of this global pandemic impacting North America right now, that even though we're doing our best to respond to what's happening around us, There's also the recognition, of course, that for many communities, we may actually be witnessing wave 2 come the fall. So some of the things that will prove to be really important as it relates to prevention and diversion will not only have an impact on some revisions and policies and practices that we're doing right now, but also into the future. So when we sort of think about prevention and diversion, and I'm assuming that I'm relying on Wally now to be my Vanna, and thank you for that. So why are we looking at prevention and diversion? We acknowledge the fact, and we've certainly seen from both the American government and the Canadian government, that there's an acknowledgement that this global pandemic and the resulting economic crisis, that it will likely increase the number of housing crises, but also potentially the inflow into homelessness. And so, of course, anyone who is familiar with OrgCode Consulting, acknowledging that we are indeed, and we love the fact that we're a band of merry misfits, that we really want to challenge the status quo, that we're committed to helping people not just do the best that they can with the resources that they have, but also to examine how do you plan for the future. And so we have to acknowledge the fact that with anything like a global pandemic, as well as some of the learnings that we've had related to previous economic crises, in addition, even if we just look at the 2008 impact that occurred with the crash, we know that at times there's a lag in the increase in the inflow into homelessness. And so this is really the time for communities to have this strategic lens around how do we make the most of our resources and how do we actually ensure that we're doing a great job of capitalizing on individual and families' resilience. And so part of the key opportunities around prevention and diversion is that these are the real opportunities within our service sector that we get an opportunity to actually not just focus on, but actually maximize and create a momentum where the natural resources, those relationships, the connections that people have in their community become so important. And so this is really an opportunity for us as service providers to assist people in the midst of not just the public health crisis, not just the financial crisis that they might be experiencing, but also that potential scenario where they're introducing themselves to potentially a pathway into homelessness. So how do we articulate and resource this vision where we want to ensure that homelessness is rare, and if it does have to occur, that occurrence of homelessness is extremely brief. And so really ensuring that we're making the most of it. When we think about some of those resources that have occurred, we know that in Canada, we have the Canadian Emergency Response Benefit, we have the expansion of the Reaching Home initiative, we have provinces and municipalities that are making the most and trying to streamline access to funding to help our industry respond to the COVID-specific needs. In the United States, revisions to everything from how you can use your ESG grants to the CARES Act, we know that there's an opportunity to really capitalize on this. And so when we sort of think about what's happening, let's just be really clear that in the coming days, the coming weeks, the coming months, we understand that there will indeed be pressure from community, in particular from community leaders, to really help particular people, potentially even a particular family who advocates really, really well for themselves, or maybe has even captured the attention of news media. And so being prepared for this political and community-based pressure is essential. We also know that as we sort of go through this COVID-19 response process, that based on history, as our communities and our countries move into more of a COVID-19 recovery lens, and homelessness is no longer seen as this massive public health crisis that must be addressed. We know that the lag that often happens, sometimes up to 5 years after, let's say, an economic crisis, that we will start to see an increase in the number of people that are entering into, often for the very first time, the journey of homelessness, with the quest of us helping them resolve that homelessness as quickly as possible. So we want to capitalize on any opportunities that you have, and much better to prepare your processes, your strategies, and your key messages now instead of scrambling to respond in the coming months. So that's the plan. So you can move to the next slide there, Wally. When we sort of think about what we're going to be talking about today, just to be really clear that we're all talking about the exact same type of activities. So when we talk about homelessness prevention, these are the activities that occur before an individual or a family has legally lost their ability to reside at an address. So the primary goal for prevention is we want to sustain any existing safe, appropriate tenancy. With diversion, of course, these activities occur after the individual or family have legally lost their housing, but we're trying to intervene wherever we can prior to shelter entry. And so when we sort of think about diversion, we often think about diversion as a preventative measure to avoid this trauma of literal homelessness, whether that looks like unsheltered homelessness or sheltered homelessness. But once again, just as with prevention, the primary focus is exploring safety and the appropriate options that might be available in the community. Rapid resolution primarily is looking at all the activities that would be occurring as people first enter into a state of homelessness. And we know, based in research, of course, that the first 2 weeks of a shelter stay, for example, are the critical opportunities where we can very quickly, with a very housing focused slant, ensure that we are helping people rapidly exit or to be diverted out of shelter as quickly as possible. So we'll look at those 3 particular activities today. So when we think about prevention and diversion in particular, some of the key questions that really guided a shift in how prevention occurred historically was the recognition being that as we looked at research, as we did the evidence around who became homeless, who got stuck in homelessness, and who was actually able to access homelessness prevention resources in the past, there's an acknowledgement being that even though there's a strong connection between economic and financial distress and the incidence of homelessness, we know that we have to ask additional questions. Why, for example, do most people, even those that live with severe economic poverty and potentially have problematic rental histories and a number of life areas that might challenge their stability, why do these folks never become homeless? We also have to ask ourselves the questions around what can we learn from people that do not become homeless, and how do we apply those learnings to those households that are at the precipice of becoming homeless, or maybe they've entered homelessness and we want to ensure that they're not getting stuck and experiencing long bouts of homelessness. So those are the 2 questions that really sort of govern how prevention in particular is viewed differently today than it would have been, let's say, 10 years ago. When we think about our system of care, there's an acknowledgement being that our system of care, although it's not perfect, and it's certainly not potentially as responsive or proactive as we would like it to be, but there's an acknowledgement being that this system of care not only relies on the service manager, the lead agency, the continuum of care agency, whatever you're talking about from this leadership standpoint, as well as how are we harnessing the data? What do we know to be true? How are we using those homelessness management information systems, or here in Canada, HIFIS, to really make the most of helping people get to the right program or service at the right time to prevent and end their homelessness? If we sort of look at what this system looks like, we know that we have housing with supports. We know that within most communities, we will also have housing without support. So whether that's Section 8 in the United States, whether that's rent geared to income social housing in Canada, whether or not there are supplements that are available, place-based potentially, any form of affordable housing. We also know from a housing with supports, everything from rapid rehousing to intensive case management to any form of supportive housing, whether it's permanent or whether it's time-oriented. The other components, of course, within this system of care is we know that street outreach, shelter, drop-in programs, meal programs, hubs, including any type of community resource that's happening in your community, that all of those particular services have an opportunity to act as a connection to a permanent solution. And so we really want to be sure that they're optimizing on understanding what people's housing situation is right now so that we can get them connected. The far left-hand side in this column, of course, we're looking at coordinated access, or for our American partners, this is your coordinated entry system. And going beyond sort of a common understanding of your coordinated access or coordinated entry are those folks who maintain the by name list in your communities and prioritize who's going to get referred to the next available Housing First program or rapid rehousing opening that's available. Coordinated access also incorporates the really important components of prevention and diversion. Well, if you just hit one more, you'll see a really important component that not only applies to coordinated access and coordinated entry, it's called progressive engagement. And so when we sort of look at progressive engagement, there's an understanding here that not all households will need the same intensity and frequency of supports. And so we're really looking at how do we customize either financial and or support services to meet their needs. So Wally, you can move forward. And again. So when we sort of think about progressive engagement, a really important conversation on the previous slide there, Wally, about equity. So when we sort of understand the difference between equality and equity, and let me put this in the lens of homelessness prevention historically, at one time, homelessness prevention efforts really operated purely on an eligibility process. It was first come, first serve. We'd have times throughout the year where the floodgates for homelessness prevention would open. And if people met the basic eligibility, we would use all of our homelessness prevention dollars until they were gone. And then the floodgates would close. And the next year, or whenever we had more additional money, again, it was first come, first serve, eligibility based, oftentimes luck. We provided oftentimes the same amount of resources to people, and we may have even had timelines attached to it. So for example, here in Ontario in the past, homelessness prevention would have been tied, at least in part, to income supports. And so it was seen that people were eligible for a set amount of homelessness prevention dollars, let's say within an 18-month period, but there was a maximum allotment. And so people started to see it more around entitlement. I should be able to get it every year. And the recognition being that we want to shift from equality, where we're providing the same intensity and the same process of identifying need and delivering finances and support services to the same people, the same level of intensity. We want to shift that to actually be much more person-centered. So when we talk about equity, we're talking about whether or not people are getting a customized needs assessment that relates to their household, that any services, any supports, any finances actually meet their need. Not just this is what everyone gets at any particular time on a first come, first serve eligibility base. The other piece, of course, with this, if we could add in a third picture for this, the third picture would encompass justice. And within that picture, we would actually remove the wall that creates that structural and systemic barrier to people actually having their needs met. We're not there yet, but we need to ensure that any decisions that we're making related to what proportion of prevention dollars are going to be used, how we're doing diversion, how we're operationalizing that, we have to do it from an equity-based decision making model. So you can move forward there, Wally, thanks. So let's have a look at some of the principles and the beliefs that have to inform our prevention and diversion activities. When we sort of think about creating this structure and developing and optimizing any of the dollars that might be coming to us, or even some of the finite existing dollars, it's important for every community to look at those fundamental beliefs, those core beliefs that really guide in what we want to achieve with our prevention and diversion. So some of the key questions: do we actually believe that people are generally resilient and that we have an opportunity in the midst of their housing crisis to intervene, slow down the crisis process, and be actively engaged in a problem-solving crisis intervention opportunity? Do we believe that homeless services should be used by people that have no other safe and appropriate alternatives? Do we believe in the consistent application of evidence-informed procedures and processes like prevention and diversion? And do we want to optimize those finite shelter spaces so that we're prioritizing people from our communities that actually need those finite spaces in our community? So when we move on, some of the key principles, we have to acknowledge that for us, making people become homeless in order to receive service is a really bad idea. So if we can prevent homelessness, even if we can intervene and actually double down on ensuring that people who have been supported to return to a level of housing stability after a period of being homeless, if we can double down on that investment that has been made within our community to help them become rehoused, and now we want to prevent their return to homelessness, then that is indeed a worthy endeavor. We also want to maximize and optimize that resilience. So we're going to focus in on that. We understand that customizing the intensity and the degree and the level of support that's provided is a good idea. And in fact, it's extremely trauma-informed. We also know that tenancies that they need to be safe and appropriate, but we also know that that takes many different forms. When we think about intervening in crisis, we also know that mediation is certainly a worthwhile endeavor, and we need to explore that and potentially be active participants in the role of mediator whenever possible. And of course, we need flexibility in the resources, both financial and our ability to provide support services in order to increase the potential for success. So as we kind of look at prevention, just sort of as a really quick touchstone, we need to know that there are some key components around prevention that have always created struggles. So some of the struggles related to prevention have to do with administrators or funders that see cause and effect when really there isn't any. So at times we believe that just because someone's in the midst of a financial crisis, and this might be a brand new experience for them, that homelessness is the next step, when in fact that cause and effect is not actually true for a lot of households. We also have to recognize that even as service providers, we at times think that we can predict how a household will do in the future. And one of the really humbling things that we have discovered is that our ability to predict is actually really bad. And so ensuring that we're using evidence-informed practice becomes extremely important. In the past as well, households that were deemed to be too high risk, so those households that not only had financial issues, but also had a number of life areas that were increasing their vulnerabilities, those households in the past were oftentimes screened out. And so really ensuring that we're aware of the fact that homelessness prevention money really should never be viewed within a community as a poverty reduction initiative on its own. So homelessness prevention, the recognition being that these are specialized resources, and we have to be aware that history has actually taught us that when we see this homelessness prevention money as an opportunity, yes, to support households that might be struggling with economic poverty, we have to be aware of the fact that we don't have enough finite resources to really focus in on poverty reduction efforts in and of themselves. We need to target how we're using our prevention dollars to have the greatest impact possible around stemming and slowing and reducing that inflow into homelessness. So just being really, really careful around how we're using that homelessness prevention dollar. Okay, you can move forward there, Wally. So when we sort of think about prevention and this history, we acknowledge the fact that some of the research that has gone in the past, it was actually discovered when we use these, previous misunderstandings of prevention, that 80% of the investments that historically would have gone towards homelessness prevention actually went to households that never would have become homeless to begin with. And so again, being very conscious about who are we dedicating and prioritizing within the prevention efforts. We know that we need to also target households that most closely resemble the vulnerabilities, the risk factors in life areas that are tied to the experience of homelessness. So it may indeed be an opportunity to double down on that investment of previously supported households prior to them returning to homelessness in the future. And of course, wherever we can, inject that objectivity within our decision-making process as an opportunity for us to be really evidence-informed. Okay, let's move forward. So, Wally, I'm going to need you to click a number of times here, but let's just have a look at this prevention workflow. So as Wally clicks through, I will take you through what the workflow normally looks like. We will start with an understanding that as people come to us, there's an acknowledgement being that they might in fact either come to us saying they need a safe place to stay, that they don't have anywhere else to go. The very first thing that we're going to do as we're engaging with people is, of course, to really look at safety screening. And safety screening within the guise of COVID-19 reality is not just safety screening for their personal safety, but also potentially screening for symptoms of COVID-19. So we recognize the fact that the homeless service system is indeed becoming part of this infection detection and contact tracing system for public health. So that becomes important. So if you just continue clicking through there, Wally, if people are indeed not safe, then we want to address that safety. So that becomes essential. For many communities, that might actually mean we're getting them connected with VAW or domestic violence, intimate partner violence resources to ensure that the safety planning occurs. Beyond the safety screening that will always happen, prevention then starts to look at, can we actually determine if we can do a prevention engagement or prevention intervention right now, or do we need to schedule it? So for those of you who have, for example, your coordinated or your connection point in your community being a telephone like 211 system or anything else, or if they can actually come into an office, identify if someone can meet and do this prevention intervention right now, or do we need to schedule it? If it's scheduled, of course, where are we going to do it? When are we going to do it? How are we going to do it? And understanding that COVID-19 and physical distancing and public health measures will change the dynamic of what would have been an in-person visit in the past. If we can do it right now, of course, we're going to get into the prevention steps. What are some of the key components that we are really going to need to be aware of so that we can do the best we can to maintain that legal tenancy right now? If we can mediate, if we can really look at what are the legalities, how can we slow this process down, can we do mediation? If it's successful, then of course, we're going to document our activities, we're going to provide the supports that have been agreed upon, all of that. If we continue on through, however, and we actually go to the left of the prevention steps, and we discovered that there's absolutely no opportunity for us to stop the eviction process from happening, then we actually get into, okay, if we cannot prevent this current eviction, we may actually need to look at what are other safe, appropriate options in our community for this household. And so we may actually get into diversion conversations. All right, so you can switch on through there, Wally. So when we sort of think about these activities, they would include everything from exploring the current tenancy agreement, what's the housing scenario, investigate all the obstacles around staying in this current unit, identifying what's happening as it relates to the residential tenancy, have the landlord tenants board been activated, doing legal services and engaging them, see if we can slow this down. We're looking for any legitimate legal avenues to intervene, which may include mediation and dispute resolution. From a Canadian perspective, I know there's tons of communities who have done some really great work as it relates to this intervention. I know Chatham-Kent has had some really amazing successes over the last year, so maybe you can chat with Chantel and some of her peeps there in Chatham-Kent and what their investment in prevention has actually done for this. The other component around looking at their current tenancy is we can't identify legitimate avenues to intervene and stop that eviction. Now we're going to start looking at other life areas that potentially will create vulnerabilities for long-term housing retention. Even if we can save that current eviction from happening so they can stay in their tenancy, there's a recognition being that some of our households will actually need some supports to maintain housing long-term. And so one of the key challenges in our communities right now is that historically homelessness prevention may not have been tied to support services. It may have only been tied to financial. And so really looking at how can we provide some of those supports to people, not only to save the tenancy in the short term, but also to maintain housing stability longer term. So really looking at all those options. We of course create the action plan with the household, follow up on housing stability, provide supports for emerging needs, but those for the most part will incorporate many of the prevention activities that we know to be true. So if we think about COVID-19 specific considerations for prevention, we know, and our governments have certainly reinforced this point, that we know that the economic downturn will likely result in an increased number of households that will actually require homelessness prevention dollars or supports. So how do we actually prioritize for those finite resources? Even if you now have more money that you could dedicate to homelessness prevention, it is not an infinite amount of money. So we still need to prioritize what makes the most sense for our particular community. We also have to be aware of the fact that in many jurisdictions, you may currently have an eviction moratorium, right? So one of the really important pieces from a homelessness prevention standpoint is ensuring that for any current supported client, whether they're in a rapid rehousing program, whether they're in transitional housing programs, whatever it happens to be, we want to ensure that people aren't incorrectly viewing an eviction moratorium that might be happening in your jurisdiction as an opportunity for them to have a vacation from paying rent. So are we actually monitoring supported clients and ensuring that they're paying their rent and maintaining their obligations? We also know that some types of shared housing, so if we sort of think about rooming houses, roommate situations, boarding homes, roomlets, whatever it happens to be, we may actually have an increase in the number of people that view staying in that particular shared housing environment as not being safe, and shelter may be seen as the safer alternative. And safe here referring to prevention from COVID-19 concerns. So are our prevention resources actually flexible enough to increase potential safety related to COVID-19 infection and transmission within somebody's current home? So can we pay for things like personal protective equipment? With reported increase in domestic and intimate partner violence at this time, we also need to ensure from a prevention standpoint that we've really partnered with our VAW and our DV type resources to ensure that they have the capacity and we have the workflow and the connections to ensure that people are getting connected to those specialized trauma-informed, violence-specific resources in their communities to really address concerns related to violence and intimate partner violence. Really, really important that we do that. Some other pieces that we also have to be aware of. When we think about prevention dollars, whether they are brand new dollars that have come through things like the CARES Act or the expansion of Reaching Home here in Canada or anything else, what proportion of those prevention dollars will be allocated for households that have a financial crisis as the cause of their housing crisis right now, versus what proportion of those dollars will be dedicated to households that were previously precariously housed and already demonstrating a number of life areas that might increase their vulnerability and increase the likelihood of them experiencing or returning to homelessness, and that was prior to COVID-19. So really looking at what we have, it's not as if we want to only serve one particular population, but let's look at how we're going to distribute those finite resources. Are we also ensuring that we want to prevent homelessness for people that are experiencing imminent homelessness, first time entry into the system? Are we using our prevention dollars as an insurance policy so that people who experienced homelessness in the past have now returned to housing, that we are actually using this as an opportunity to ensure that they are not returning to homelessness in the future? We have to remember that the one primary predictor that we know to be true is that people who've experienced homelessness at least once in the past are at an increased likelihood of experiencing it again in the future. So being really, really cognizant of who's getting those prevention dollars. When we sort of think about homelessness prevention and with an equity orientation, really take the opportunity to examine within your community who's being served currently related to homelessness prevention, and just as importantly, who is not. And then take that within the lens of COVID-19. So we want to ensure that our policies and the procedures are promoting equity. We have the flexibility and resources to ensure that people are getting the right intensity, the right amount of financial services if they need them, and being as equitable as we possibly can based on local needs. When we sort of think about some of the other COVID-specific prevention pieces, if we're going to prevent future evictions, if we want to intervene and people can stay in their current tenancy, what are our strategies for ongoing landlord engagement, for mediation? How do we support them so that this tenancy does not need to end? What about for people who are hospitalized as a result of COVID-19, potentially already precariously housed, potentially already experiencing a higher depth of need in terms of life areas that are impacting their ability to stay housed? Do we have an early detection effort in place to identify? And do we have any form of rent bridging programs? So for people who are hospitalized, they can't return home right now, but if we can maintain that tenancy, they will have a place to return to after they're released from hospital. We also know that in terms of prevention efforts, a lot of communities historically tied prevention efforts together with employment access. This will continue to be important, of course, but with today's economy and the impact in terms of the economic crisis that is also happening related to COVID-19, sustainability of housing may also need to focus in on accessing any other available subsidies, supports via government, income support, social security, whatever it happens to be that's available to us, not just personal income from employment. And then of course, the last one, which will always keep coming up as we think about prevention initiatives, are things like rent banks. So when we sort of think about rent banks, for the most part, it would be interest-free loans, that people could have with the expectation that you pay it back over time. Just as a reminder, we need to be aware that these rent bank options rarely have payback rates that will make them self-sustaining. So they often descend into grant programs or forgivable loan programs. So just be cognizant of that if this is a route that you're considering. So the last little slide here as it relates to prevention, really ensuring that we're considering how we're doing prevention so that we can identify both social services as well as funding, that what we're providing to each household is actually dictated by the level of need that's presented by that particular household. We know that we're going to need some flexibility to adjust to changing needs within the household. So that flexibility will be really important, but also ensuring that we're incorporating evidence-informed tools and approaches into our process. We know that within the midst of crisis, as humans, we tend to look for areas where we can have command and control. The acknowledgement being that with finite resources, including prevention resources, we want to decrease that subjective approach of wanting to rescue people who are currently in crisis and really focus in on maximizing their resilience and their opportunities and all of the tools and finances that we have. For those communities that are wondering about a objective tool, there is the Prevention Rehousing VI SPEDET. There's currently versions available for families and for single adults, and this will look at beyond financial component and housing sustainability investigations. It'll also look at vulnerability in other life areas. So I'll make sure that Wally has that and he can share that along with the presentation. So as we sort of look at diversion, let's investigate what we have here. When we sort of think about diversion, we know that diversion happens when there's no longer a legal safe tenancy. We know that people might initially be seeking shelter services. And we know that there are times, especially if you're at the front door of shelter, where diversion may not be possible at certain hours of the day. We also know that one of our key opportunities is to intervene so that if homelessness has to become a part of their current experience, we want to ensure that unsheltered and sheltered homelessness can be avoided if at all possible, as long as we can maximize their natural supports. So we want to do that really effectively. So moving forward, when we think beyond diversion, the acknowledgement being that diversion looks for safe and appropriate opportunities within community for people to be. Again, the workflow, we will first do safety screening. Not just safety in terms of personal safety, but also potentially around COVID-19 symptoms. If they are unsafe, we're going to address that safety. For some communities, addressing that safety, again, will be connecting them to DV or VAW resources. If they're currently safe, Again, can we do diversion in the here and now, whether it's over the telephone or if it's in person at a shelter or at a help hub? Or are we going to actually have to schedule an appointment? And so if we are scheduling, where, when, and how? In terms of the diversion steps, we will always talk about the 9 steps of diversion. We're going to follow those steps. If those steps are indeed effective, then we will follow through with our action plan. We're going to do the documentation, and we're going to be ready to re-engage if somebody comes back to shelter after a period where they were able to stay in community, but now they're back at shelter looking for shelter admission again. If, however, diversion is unsuccessful, then of course we're going to look at vacancies within our shelter system, potentially even if they're demonstrating COVID-19 symptoms, not only our shelter system, but potentially some of those isolation and public health oriented environments that have popped up in our communities to really meet the need. If there is no vacancy for shelter, safety planning will continue to be important. Once they get into shelter, then we're really looking at the awesome work that housing-focused shelters do around helping people, in particular in those first 2 weeks, to self-resolve if they can. So working on that active housing plan itself and maximizing both passive and active resources. Only if they're unable to self-resolve within a set period of time in shelter would we look at intensifying the assessment of needs. So whether that's a shelter worker who's doing a triage tool or a fulsome assessment, whatever it happens to be, and then we tap into our coordinated access or coordinated entry to really do that prioritization for finite homelessness specific rehousing resources. So when we think about COVID-19 specific issues related to diversion, as I mentioned before, because our homeless services have really evolved into an early COVID detection and even a contact tracing system, together with our public health partners, we know that not only are we screening for diversion, we are also screening for symptoms of COVID-19. And generally the recognition is we screen for COVID-19 symptoms first. The other piece, of course, is that we want to recognize the fact that shelter and potentially even staying outside may be viewed as safer alternatives for some of the individuals and families that we're working with and engaging with. So they may see shelter as a safer alternative to staying with family or friends or other natural supports right now because of COVID-19. Some people may actually say, I'm not interested in shelter. I view staying outside as the safer alternative because of COVID-19 and wanting to stay away from a congregate environment. The other piece, as I mentioned before, that for some jurisdictions that have an eviction moratorium, people may actually see it as a hiatus from having to pay rent. And so suddenly they're entering eviction mode and potentially a return to homelessness. So being very conscious of what's happening there. The other pieces, of course, is that the nuances of COVID-19, we have to acknowledge that diversion efforts really have to take into consideration that physical distancing, self-isolation, or potentially even quarantine measures can make it really difficult for people to engage with family and friends. And so part of our diversion will now have to be an understanding of which people they're already engaging with. And if they're going to be staying with a host family, have we screened for symptoms within that host family? So really being aware of what's happening in that regard. When we think about safe and appropriate housing options, can we, for example, also ensure that any personal protective equipment that might be required to reduce the risk of infection, if that's available? And chatting with our public health partners around things like, if you're introducing a brand new person into a host household, is there the need for that entire household to have a 2-week self-isolation period? So really understanding what we're doing here. So moving forward, we want to know, for example, that diversion is indeed effective. It is indeed strength-based. It is indeed ensuring that we're customizing the level of support that's being provided. It's person-centered. It is indeed trauma-informed. We're doing things with people, not to them and not for them. And we know that if we can focus in on their natural supports when they're safe and appropriate to do that, that we are indeed reducing harm. Very quickly, and I'm going to rely on Wally to take us through this really quickly in terms of the slides, the recognition that if we look at these 9 steps of diversion, and I'm just going to flow through them really quickly, we know that in terms of having the conversation with people who do not have a permanent legal tenancy that they can stay attached to, we're going to have a conversation. We're making them really aware of the fact that we're going to, number 1, screen to make sure that they're safe. Number 2, we want to have an opportunity to look at their current situation and what's happening for them. And we're here to help them resolve the issue, really ensuring that they don't see their current housing crisis as something that you should solve for them. We're working with them. So when we first look at the step 2 here, we're looking at why are you seeking service today? And what else have you tried before coming to us as a third-party agency? And what are some of the opportunities where you could potentially resolve your current housing crisis that you've thought about, but maybe you haven't tried them yet? So this is the real opportunity to really delve in and see what's happening and to maximize this resilience and people's relationships and their natural supports to empower and encourage them wherever we can. So when we think about step 3 is all about recognizing the fact that today we have a household who's coming to us potentially seeking service. What's happened in the last 24 hours? So they didn't come yesterday and they're here today, not tomorrow. So what occurred? Step 3 here is all about let's explore where you stayed last night. If people are staying outside or in a place that's not fit for human habitation, then of course we're not going to continue exploring where they stayed tonight. We're going to skip over a number of steps here. But if they're in their own unit last night, if they stayed with family or friends, we're going to look around, how safe was that environment? And potentially, could you stay there another 3 to 7 days if possible? What would be required? One of the really important pieces beyond step 3 and step 4 is we want to really explore what are potential safety concerns and what's the story behind the story. So can we assist you in slowing down this housing crisis? Look at it for the next 3 to 4 days. Are you safe? Is this appropriate? Are there resources that we could actually assist you with? The other components around this are any other additional resources that you might have that could actually assist you in the short term to overcome your current housing crisis. So these are all really natural discussions that prevention and diversion specialists do a really great job at. They're not looking at everything around all the life issues happening in your life. We're looking at the here and now. And can we assist you in addressing this current crisis? So when we sort of look at beyond step 5, we're really looking at that story. And if they can't stay where they stayed last night, are there other places that they could potentially stay at? Even on a temporary basis, what could we help you with? When we think about the 30% of individuals that come and do a diversion intervention, 30% of them generally can be assisted in staying in community in safe, appropriate places and never have to enter into sheltered or unsheltered homelessness. There's an acknowledgement being that once again, just like for prevention resources, diversion could you stay? Step 7, of course, is the first and only time that we start looking at other life issues that might actually get in the way. When, so anything about income, any sources, and then of course, if they have to come in to homelessness, we want to be really clear with them that we're defining the purpose of our homeless service delivery system as ending people's homelessness. So there's a plan that we're going to be housing focused. This becomes extremely important. So in step 9, we will actually be really clear that if they enter into shelter, that there's an expectation that they will actually be actively working on a housing plan to secure housing. And so we really, really, really want to focus in on that. All right, let's move forward. So considerations for diversion. We always look at the most appropriate and the safest option. We will always have to do screening for COVID-19 symptoms, not just for the people that are in front of us that we're having this diversion interaction with, but also for any host households. And so being really clear about what is the potential risk factor for any household that would be hosting an individual in their own home. The other piece related to this, of course, is the guidance that we're going to need from our health partners. So how do we reduce infection and transmission as we explore appropriate and safe diversion options? What's the demand for self-isolation? What is the need for personal protective equipment? Do they have the cleaning supplies that we know will be so important? All of those things. And the goal with diversion, just like the goal for prevention, is we want to customize this support structure, whether it's finances, whether it's gift cards, whatever it happens to be in terms of helping this individual or household find a safe place that's appropriate for them inside community. How do we assist them in doing that? When we think about our efforts to prevent eviction right now, to divert people from unsheltered or sheltered homelessness, if we can possibly, result in them not having to enter into that literal homelessness state, we can help them find a safe, appropriate place. We know that there will be a proportion of households that will either return to homelessness or will enter homelessness for the first time. And so when we think about rapid resolution, we know that there has indeed been an expansion of rapid rehousing resources, both financial for continuum of care, as well as community entities in the Canadian and the American context. How are we going to capitalize that? So is it possible, for example, that we will rapidly rehouse many of the folks who could not be diverted from shelter, but we want to ensure that we're preventing them from experiencing long bouts of homelessness? We also recognize that the rental market in some communities may soften a lot and allow for rehousing as a solution to either avoid homelessness or to rapidly exit homelessness. So are our communities ready with housing location activities and landlord liaison activities to really capitalize on that opportunity? When we understand those financial and support resources, there's the recognition being that your community will likely need financial and low support rehousing track for households that have economic issues, but no other substantial support needs. So when we think about rapid resolution, we also have to be aware of the fact that progressive engagement and customizing the level and intensity of support that we provide within community also has to be part of our considerations, because we never want those lower acuity households competing with high acuity households who've experienced lengthy periods of homelessness already, and they're now competing for access to these highly specialized and intensive rehousing resources that normally would be delivered within our homeless response system. So really thinking about how are you going to capitalize on those opportunities and not create a competition between lower acuity households that certainly will be potentially needing some supports financially or support mechanisms, but not competing with those that were already high acuity, high on our priority lists within our by name lists and our coordinated entry. So all of those things become extremely important. So some things to think about for rapid resolution, rapid exit. You want to queue up those housing location and landlord liaison activities. We have lots of communities that are doubling down on their diversion efforts. For example, Calgary Drop-In Center has done awesome work, even in the midst of COVID-19, in doubling down on diversion. They also know that with those particular doubling down efforts, we're still going to need housing location, landlord liaison activities happening in the community. We know that the first 2 weeks of homelessness, the greatest opportunity for rapid exit. So we want to focus in on that action-oriented housing plan. We want to ensure that we're customizing the level of support that we're providing for people. We also want to have those passive resources that are housing focused, ready to go. For many people, the housing relocation component will incorporate things like, do we need to activate income support, Social Security, any emergency response benefits that we could tap into? Are all the documentation components ready, including identification? And of course, the recognition being that housing options for people is just like everything else. It's not one size fits all. So how are we really ensuring that we're making the most of the opportunities as they exist within our current communities? When we sort of think about the rapid resolution, the prevention, the diversion, we have to understand that we, in the final reckoning of how communities responded to this COVID-19 crisis, that the work of the homeless response system will also be a part of that autopsy, if you want to call it that way. We will be investigated to see how well have we done to really respond to the needs of households that are in a housing crisis, are already in homelessness, or at the point of becoming homeless. Throughout all of these prevention, diversion, and rapid resolution efforts, we need to monitor our efforts, and we need to be able to create this narrative around what impact did we have. So data will continue to be important. Here are some of the key data points. Who gets diversion and prevention and why? So what's the demographic data of who was accepted and who was denied? Who was successful, not just in getting the support, but also never having to enter into homelessness? When do they actually get prevention and diversion? So how long does it take from the first point of contact to them receiving the supports, finances, or support services that they require? What assistance are people receiving? And what difference did that assistance actually make? So let's talk about impacts, outcomes, in particular housing outcomes, and any data that we can get our hands on related to recidivism back to the homeless sector. How does this information around these, intensified prevention and diversion, how does this compare to data of people who did enter into homelessness for the first time during this period? What do we know to be true from our success stories related to prevention and diversion, as well as those who entered into homelessness? Could we ensure that those bouts of homelessness were short, non-recurring? And how does this overall, what's the data regarding people who returned to homelessness during this particular period? How could we have improved our service delivery around housing supports to ensure that they did not return to homelessness in the future? But the monitoring of our efforts will be extremely important moving forward. And next slide, that's it. I channeled my inner Newfoundlander and did the best that I could in terms of creating a ton of information for you. I'm gonna put it back to Wally right now in case there are key questions that you want to ask, but the PowerPoint slide, as well as some resources that are specialized for diversion and prevention, will be forwarded all to you in the link. So I wish you well. Thank you very much.
Awesome. Thanks, Tracy. Really appreciate it. There was tons of, as you said, tons of great information there. I first of all want to be mindful of your time. Are you okay to maybe take a question or two? Okay, great. And so if there are people that are still, we're able to still hang on due to time that have questions, then let's go ahead and take a couple. I'd hate to leave them with this empty spot in their brain. So Jody, any particular questions that you think would be great to kind of address right now?
Well, I know that Helen Kelly, if she's still on the line, had a question about research.
Maybe just because of time, we'll just go ahead and read them instead of trying to find them.
I'm just trying to find it. Let me scroll up. She just was asking about the 80% stat.
Yeah.
And what research that comes from. She said, I believe you, but if I,
but prove it.
but if I do it, I will be asked what it's based on.
You bet. So an awful lot of the initial research, of course, we think about the American venues and some of the HPRP research that happened, a wealth of knowledge there, also a wealth of knowledge that came out of specifically Arizona, specifically through some of the work that we've done in Ontario in particular. So when I forward the information, Helen, I can actually share some of that prevention and diversion research with you so that you've got you're armed with everything that you need.
And I know that Jamie has had to go to another meeting. She jumped off, but she did ask, what strategies do you suggest for managers of case managers in a program trying to move the program from equality to equity? Goes on to say, it feels like case managers know that the max time, 6 months or whatever it is there, and that they can keep clients on the program and expect all clients will get that max time.
You bet. I think what becomes really important for us to think about, and this I think tends to come more through, yes, research as we learn new things and we glean this empirical research, we have a much clearer understanding of how we can make the most of finite resources, including our time. But I think what becomes really important in the here and now is the coaching and the supervision and some of the quality assurance and quality control pieces that make programs like prevention programs high functioning. And so when we sort of think about how do we do that, I think having really open conversations about what are our core beliefs and our core principles that guide how we do things like prevention and diversion provides this platform for us to have these conversations and potentially have difficult conversations internally about how finite staffing resources are being used. So really looking at that, and I will certainly be open if people want to have a conversation about how you address that within a staff team, that would be great. I make sure that you have my contact.
So Tracy, would you also say, because my perspective is that I think that there's a lot of times that funders and government organizations have kind of handcuffed people in that way, by putting specific guidelines in place around time and so forth. And so there's probably a really real benefit to continuing to advocate to those people to say, give us some flexibility.
You bet. And I think, realistically, as we start to talk internally within our industry, our sector, this discussion around equality versus equity versus justice has to be a part of our conversations. And I think it's in some ways an easy out if we provide the exact same amount of money for everyone who's eligible, where prevention becomes more of an administrative task instead of a true engagement and interaction with people that are coming to us, yes, with a crisis, but are we really capitalizing on our opportunity to engage in a trauma-informed, person-centered way, instead of just saying, oh yeah, you're eligible for $1,800 over the next 3 years. If you tap into it now, you can't come back until 3 years passes. That was the old way of administering homelessness prevention. So really doing the needs assessment becomes important.
Well, and I think part of what I'm hearing from Jamie's question too is that, case managers feel this pressure to, they both to keep people for their max time, but also they're getting the pressure from the other end that, but you've got to move people along because there's more people that need spots on those caseloads, right?
Totally. And I think, incorporating objective assessment tools as we engage with people for a longer period of time helps us identify when do I need to continue working with this household and when can they actually do quite okay without me. We have to remind ourselves that perfectly imperfect people can be perfectly housed. So we don't need to be all things to all people.
Right, right. Thank you.
We have another question here about looking for strategies or examples of braiding private funding with agencies that receive government funding.
Love it. So braiding together of different funding pots becomes extremely important if you want to diversify what populations of people you're able to serve most effectively with prevention, with diversion, with rapid resolution activities. And recognizing the fact that we, even though we're the rulers of our own universe, we know that we don't always have the ability to tell funders that they're really wrong, what they're saying is incorrect, we're not going to do that. And so, you know, if you can braid together a number of different pots of funding, it allows you to diversify not just what your federal, state, provincial funders are telling you you will do with this money, but also really customizing around what are the real needs within our community and how do we use these other areas of funding that is available to us to really ensure that we're customizing how we do prevention and diversion to meet the needs of our individuals and our households locally.
Great. Looks like there's one last question maybe about the prevention via ISPDAT. I think the question is how does it compare to the VI SPDAT?
Right.
They were unaware that there was a prevention version.
Yeah, so prevention rehousing VI SPDAT is actually was actually created out of a call from multiple communities to please provide us with something that will allow us to not just look at people's financial crisis that they're currently in, but also to look at other life areas that may actually indicate to us as practitioners that beyond financial supports, maybe we also need to do some homelessness proofing into the future. And so when we compare the prevention rehousing VI SPDAT to the regular VI SPDAT, prevention rehousing or PR VI SPDAT is actually written for people who are still in a legal tenancy. So all of the questions will not be written or portrayed by you as the practitioners if that individual is already homeless. It'll talk about whether or not they've been exposed to violence or they've been exposed to safety concerns over the last 6 months within their current housing situation. It'll also look at housing sustainability. So it will promote for practitioners this understanding that if people are not interested in staying in their current tenancy long term, is it really a good use of finite resources to pay for, let's say, rental arrears? You pay it and then they leave within 2 weeks of you paying rental arrears. And so housing sustainability is also part of what happens within the prevention rehousing VI SPDAT. Yep. So I'll share that with you.
Okay, great. And any last questions, Jody?
Felix is just asking about further trainings on mental health, compassion fatigue, vicarious trauma, that kind of thing, looking for resources.
So Tracy, I know, like, I'm pretty sure you guys do some work in that area, right?
Yep.
Yeah, so definitely reach out and connect with Tracy around that. There's some stuff that we do from the TTA in that perspective as well. So there's lots of resources out there, but yeah, feel free to connect with Tracy and see what they can do for you there. So, you know, I think it's a pretty good indication that we still have at 20 minutes past the hour, we still have 158 people or so, 155 people hanging on the line. So I think that's a good indication of the reception of the information. So again, Tracy, I just want to say thanks. Really appreciate your time. And I apologize for a couple of the slides. It wasn't showing me what was coming next.
No worries.
I was trying to figure out, especially the flow there. That was a tough one, but we got through it, and I think people got the gist, and then they'll get to see it. later in the slides. So
Excellent. Thanks so much.
Thanks a ton, and thanks everybody for joining us. And please check our websites for indication of other webinars that we have coming up. I won't take the time to go over them right now, but feel free to go to the website you see here, and you'll see any of the other webinars that Canadian Alliance is doing. So thanks again, everybody, and enjoy the rest of your day and be safe out there.
Thanks, everybody. Stay well.